Question 1. During a counseling session with a patient who was diagnosed with depression, the patient states, "I know my husband doesn't love me anymore." Which response by the healthcare provider demonstrates therapeutic communication? C. What happened to make you think your husband doesn't love you anymore? Initially, the healthcare provider will want to communicate understanding of the situation. Therapeutic communication in this situation would consist of asking a question to explore the patient's perceptions and value the patient's feelings. Question 2. A young man with newly diagnosed human immunodeficiency virus, HIV, asks the nurse if he is ready for hospice care. How should the nurse respond? A. Hospice care is intended for people who will die in a few weeks or months. Hospice care is a special service for clients and families when the client's life expectancy is just a few weeks or months. According to HIV.Government, HIV+ people who do not receive antiretroviral therapy, ART, can progress to AIDS in about 3 years. With ART, clients with HIV can live for decades without progressing to AIDS. Question 3. Which of the following alterations in sensory function is normal for an elderly client? C. Decreased chronic pain perception. As people age, the perception and reporting of chronic pain decreases after the 7th decade. Studies show that many elderly people believe that chronic pain is a natural part of aging, and they consider pain less serious than other life events, such as loss of a spouse or independence. Acute pain remains consistent across all age groups. In general, the aging process causes the sense of taste to diminish because of reduction in the number of taste buds and shrinkage of those that remain. The sense of smell also decreases, which compromises both smell and taste. Eyes become more sensitive to glare and harder to adapt to darkness. Hearing and balance are also affected because of changes in the auditory nerves. Question 4. A provider notifies the inpatient mental health unit that he is admitting a client with a diagnosis of severe anxiety disorder. The client arrives to the unit, crying hysterically. The most appropriate action for the nurse is to B. Stand or sit calmly next to her. An extremely anxious client will not be able to tolerate activity, so the nurse should offer compassion and a sense of security. Later in treatment, the client may be able to verbalize her feelings or participate in activities. Question 5. Which of the following most indicates that a woman is having difficulty adjusting to her mastectomy 2 days after surgery? C. She refuses to look at the dressing. If the client refuses to look at her dressing, it means she is having difficulty acknowledging or accepting the reality of the procedure. A prosthesis isn't worn until healing is adequate. The nurse can educate the client on this, on resuming strenuous exercise, and on recognizing signs of lymphedema from axillary node dissection. Question 6. A healthcare provider is caring for a patient who has undergone electroconvulsive therapy, ECT. The patient should be carefully assessed for which of the following common adverse effects of this treatment. C. Headache and memory loss. Electroconvulsive therapy, ECT, is a procedure performed under general anesthesia, in which small electric currents are passed through the brain. ECT induces a seizure, which can cause transient increases in blood pressure, pulse, and intracranial pressure. The most common adverse effects that a patient may experience after ECT include headache, confusion, and memory loss. ECT seems to cause chemical changes in the brain that can reverse symptoms of certain conditions, such as severe depression or suicidal tendencies when patients are unable to wait for medications to take effect. Question 7. A male patient tells his nurse that the CIA is monitoring and recording every movement, and microphones have been planted in the walls of the unit. Which response by the nurse would be the most therapeutic? B. This must seem frightening to you, but I believe you are safe here. Delusions are common in schizophrenic patients. The patient absolutely believes the delusion is true, in spite of any evidence to the contrary. Acknowledge the patient's feelings and offer support, but do not contradict. Doing so could lead to a lack of trust by the patient. Waiting to talk about the beliefs only reinforces the delusion. Isolation increases fear and anxiety. Question 8. When a client diagnosed with bipolar disorder returns from a church service and tells the nurse, "God has chosen me for a special mission," the nurse understands that the client is displaying symptoms of C. Ideas of reference. An idea of reference is a person's belief that everything that happens is somehow related to the person's destiny. In this example, the client believes that the church sermon and all the songs and bulletins are messages from God, intended only for the client. Ideas of reference are related to schizophrenia, delusional disorder, and the manic state of bipolar disorder. Question 9. A patient diagnosed with Alzheimer's disease, AD, is demonstrating signs of impaired reasoning. The healthcare provider suspects an alteration in which area of the brain? C. Frontal lobe. The frontal lobe controls responses from the rest of the central nervous system. It is responsible for emotion, behavior, intellect, and memory. If the patient is demonstrating signs of impaired reasoning, frontal lobe function is involved. The occipital lobe regulates the comprehension of visual images and written words. The hippocampus is the center for learning and processing information into long-term memory. There are 2 amygdalae in the brain, part of the limbic system that controls emotions and the ability to perceive emotions in others. Question 10. A 9-year-old girl with a diagnosis of attention deficit hyperactivity disorder, ADHD, is starting on methylphenidate, Ritalin. What will the pediatric nurse assess during follow-up appointments? A. Height and weight. A possible adverse effect of stimulants such as Ritalin, Adderall, and Concerta is the slowing of growth. A 2013 study found that by adulthood, most ADHD children who had received such medications had achieved normal height. However, growth is still monitored during medication therapy. Question 11. The parent of an infant born with a facial deformity is hesitant to pick up and cuddle their newborn. What is the nurse's best response? A. Can you share with me what you're feeling right now? The nurse should encourage the parent to express their feelings. Don't assume the parent is hesitant because of the facial deformity. During the first 2 years, babies experience attachment by learning to trust parents and feeling secure. Parents create attachment through touch, comfort, and tending to their baby's needs. This is essential for physical and emotional development. However, the nurse should not state this to make the parent feel guilty. The nurse should not give advice or distract by speaking vaguely of the future. Question 12. The nurse is facilitating a group discussion on the inpatient mental health unit when a client begins to experience a panic attack. What is the nurse's most therapeutic action? C. Accompany the client to another area and stay with them. When a client experiences a panic attack, the nurse should take the client to a quiet area and stay with them. The nurse should remain calm and provide reassurance and comfort measures. Use short, simple sentences. When the client's anxiety has resolved, explore possible reasons for the event. PRN medications may be indicated. Question 13. Parents take their 16-year-old daughter to the mental health clinic for treatment of self-harm from cutting. Which of the following statements about non-suicidal self-injury disorder, NSSID, is false? B. The client is at a lower risk for suicidal behavior. Non-suicidal self-injury is not yet recognized by the American Psychiatric Association as a diagnosable mental health condition. And NBSB. However, it is associated with other disorders and should be assessed. Although an act of self-harm differs from a suicide attempt, there is a strong association between self-injury and suicide attempts. It seems that as incidents of self-harm increase, the likelihood of suicide attempts also increases. Clients who have engaged in 20 or more self-harm episodes are about 3.5 times more likely to attempt suicide. The other 3 statements are true. Question 14. A patient is brought to the emergency department by a family member. The patient has been agitated for the past several hours and has alternated between grandiosity and expressing a desire to commit suicide. Upon examination, the patient is diaphoretic, hypertensive, and tachycardic. Intoxication with which of the following substances would contribute to these symptoms? A. Methamphetamine. Methamphetamine intoxication causes a surge of adrenergic stimulation secondary to increased epinephrine and norepinephrine. Methamphetamine use and overdose can be life-threatening. Physical signs are hypertension, tachycardia, and arrhythmia, which can lead to circulatory collapse. Hypothermia and seizures may occur. Behavior changes can include insomnia, anxiety, aggression, hallucinations, mood disturbances, and paranoia. The patient's presentation is related to decreased monoamine degradation and an increased amount of monoamines in the nervous system synapses. Question 15. Following extensive blood work, a client is informed that she has cancer. She tells the nurse, "I think these results are wrong. I ate lunch before the blood was drawn, so we should test again." The nurse knows the client is using which defense mechanism? A. Rationalization. Defense mechanisms soften the blow of bad news by changing reality. Rationalization helps a client explain information with faulty logic. Denial is refusal to accept facts. Compensation covers up a weakness by embellishing. Coping is a generic term. Question 16. A healthcare provider is caring for a patient diagnosed with a mild cognitive impairment. Which of these would be the most effective intervention for this patient? A. Frequent reorientation. Frequent reorientation is the most effective intervention for a patient diagnosed with mild cognitive impairment. Behavior modification is an intervention aimed at changing undesirable behaviors. Restraints can increase agitation and should not be used unless absolutely necessary and only when certain criteria are met. Question 17. You are taking the history of a 14-year-old girl who has a body mass index, BMI, of 18. The girl reports inability to eat, induced vomiting, and severe constipation. Which of the following would you most likely suspect? C. Anorexia nervosa. All the clinical signs and symptoms point to anorexia nervosa. The key feature of anorexia nervosa is self-imposed starvation, resulting from a distorted body image and an intense, irrational fear of gaining weight, even when the patient is emaciated. Anorexia nervosa may include refusal to eat accompanied by compulsive exercising, self-induced vomiting, or laxative or diuretic abuse. On the other hand, bulimia nervosa is characterized by binge eating followed by feelings of guilt, humiliation, and self-deprecation. These feelings cause the patient to engage in self-induced vomiting and the use of laxatives or diuretics. Multiple sclerosis, MS, is a demyelinating disease in which the insulating covers of the nerve cells in the brain and spinal cord are damaged. Systemic sclerosis or systemic scleroderma is an autoimmune disease of the connective tissues. Question 18. A patient diagnosed with an anxiety disorder is prescribed a benzodiazepine. When teaching the patient about the medication, which of the following information would the healthcare provider include? A. Call our office right away if you experience increased restlessness or agitation. Benzodiazepines increase the effects of gamma-aminobutyric acid, GABA. GABA is the major inhibitory neurotransmitter in the central nervous system. Decreased anxiety and a feeling of drowsiness are expected effects of benzodiazepines. Patients should be advised of a possible paradoxical reaction of restlessness or agitation. Question 19. A college basketball player is paralyzed from the waist down after a motorcycle accident. They later go on to win a gold medal in wheelchair basketball at the Olympic-Paralympic Games. What defense mechanism has the athlete used? B. Compensation. Compensation is defined as excelling in one area to make up for real or perceived deficits in another area. It can be conscious or unconscious. While it is usually beneficial, it can cause problems if misused. Denial is the refusal to admit or recognize that something has occurred or is currently occurring. Repression keeps information out of awareness. Displacement is taking out feelings or frustrations on others that are not threatening. Question 20. A client is admitted with burns on the torso and both legs. The provider prescribes an initial dose of 500 milliliters for human albumin 5%. When the nurse reviews the client's chart, which of the following requires notifying the provider before administering the albumin? C. The client is a member of Jehovah's Witnesses. Jehovah's Witnesses believe that the Bible prohibits Christians from receiving blood transfusions, including blood components. Albumin and NBSB is a plasma-derived and NBSB blood product. It is appropriate to discuss the treatment with the client and respect the client's decision. Human albumin is also contraindicated in severe anemia, cardiac failure, renal insufficiency, or a history of allergic reactions. Diabetes mellitus and penicillin allergy are not contraindications. Normal adult hemoglobin levels are as follows: male 13.5 to 17.5 GDL, female 12.0 to 15.5 GDL. Question 21. What behaviors can be expected from a new patient who has been diagnosed with disorganized schizophrenia? A. Social withdrawal and nonsensical speech. Disorganized schizophrenia is characterized by regressive behavior with social withdrawal, odd mannerisms, and nonsensical speech, including making up words. Absence of prominent symptoms and little or no emotional expression are characteristic of residual-type schizophrenia. Stupor, no psychomotor activity, or the presence of waxy flexibility, maintaining a position until moved by another person, are indicative of catatonic schizophrenia. Suspiciousness toward others, auditory disturbances, and increased hostility are characteristic of paranoid schizophrenia. Question 22. The nurse is using a professional interpreter to obtain a medical social history from a client who is not proficient in English. Which of the following is the correct way to interview the client with an interpreter? C. Face both the client and the interpreter. According to the U.S. Census Bureau, more than 25 million Americans speak English less than very well, and more than 60 million speak a language other than English at home. Title VI of the Civil Rights Act mandates that interpreter services be provided for patients with limited English proficiency who need this service. Untrained interpreters, such as family members, are more likely to make errors and violate confidentiality, and increase the risk of poor outcomes. Children should never be used as interpreters except in emergencies. When using an interpreter, the nurse should address the patient directly and seat the interpreter next to or slightly behind the client. The nurse should observe the client's nonverbal cues. Statements should be short, and the discussion should be limited to 3 major points. In addition to acting as a conduit for the discussion, the interpreter may also serve as a cultural liaison between the staff and client. Question 23. At a routine checkup, a 17-year-old male with cystic fibrosis tells the nurse that he's tired of being sick, feels worthless, and wonders if he'd be better off dead. The nurse knows this means C. His statement should not be ignored or challenged. When anyone talks about suicide, they should be taken seriously and given immediate assistance. The nurse must report the patient's statement to the provider and his parents. The other options may have value at a later time. Question 24. A pediatric nurse is caring for a 9-year-old girl with a known history of having been abused. Which therapeutic action should the nurse include in the child's care plan? B. Ensure that the care setting allows the child to redevelop trust. An abused child will require long-term support and therapy, starting with an environment of safety, security, and empathy. The nurse can model appropriate behavior while giving care. Question 25. The nurse working in an assisted living facility is preparing morning medications when a female client enters the breakfast room, wearing only her underwear. Which of the following is the most appropriate nursing intervention? B. Walk the client back to her room and help her select an outfit. Confused clients are not aware that they have done anything inappropriate. The nurse should quietly assist this client back to her room and help her select an outfit. The intervention should be direct and help the client avoid embarrassment or shame. Telling her that she is offending others or asking her to observe how others behave is not therapeutic. The nurse should treat the client with respect and compassion while providing direction and orientation. Question 26. The nurse is precepting a new LPN who is caring for a client with dilated cardiomyopathy. The client is withdrawn, refusing to eat or ambulate. The client also has no interest in watching their favorite television shows. Which of the following statements by the LPN would indicate a lack of knowledge and the need for more instruction in therapeutic communication? A. Why don't you want to eat today? It is non-therapeutic to ask a why question. If the LPN asks the client for an explanation, the client can feel intimidated or misunderstood. The nurse can acknowledge the client's behavior. You seem quiet, ask for a possible identification of feelings, can you describe, or explore some reasons, tell me how, to draw out the client and get some verbal responses. Question 27. When a healthcare provider is planning care for a patient diagnosed with Alzheimer's disease, AD, which of these interventions is most therapeutic? C. Encouraging both verbal and nonverbal communication. As the ability to communicate verbally declines, nonverbal communication may become more prominent. Encouraging both can facilitate communication and decrease frustration. Speaking clearly and calmly is effective, but increasing the volume of the voice is not effective and can increase the patient's anxiety. Giving several directions at a time is useless and frustrating for the patient. Question 28. An adolescent with a history of anorexia nervosa is admitted for treatment of a relapse. Which nursing action will best promote weight gain for the client? B. Sit with the client for meals and 1 hour after. The nurse should stay with the client during meals and for an hour after, so the client can't hide or dispose of food, or vomit after eating. Weighing the client and maintaining I&AMP-O monitors the client's status, but does not impact weight gain. Giving the client a calorie chart is not therapeutic and can be counterproductive. Question 29. The nurse is preparing a workshop for families of clients with chronic mental illnesses. The topic will be relapse and rehospitalization. What should the nurse stress as the primary cause for relapse and rehospitalization? B. Stopping medication or not taking it as prescribed. For clients with mental illness, the primary cause of relapse and the need for subsequent rehospitalization is non-compliance with medications. The other options may also be factors in a relapse, but they are not cited as the main reason. Question 30. A parent makes an appointment to bring their 6-year-old child with a diagnosis of autism spectrum disorder, ASD, to the pediatric clinic for a routine checkup. Which intervention will best meet the needs of this child? B. Offer a walkthrough of the office before the appointment. The nurse and clinic staff should offer a visit during a quiet time before the appointment, to reduce anxiety. Autism spectrum disorder, ASD, is a developmental disorder that can manifest in a variety of ways and affect how an individual communicates and interacts socially. Many children are anxious during medical appointments and examinations. Children with ASD can be especially upset because their routine is interrupted. The nurse should communicate with the parent before the visit to determine what accommodations are helpful, such as reduced noise or lighting. External stimulation should be minimal. Parents can bring sensory tools and comfort items. The nurse should address the child and allow for questions if the child wishes. Repetitive movements, such as hand flapping, should be allowed as much as possible. Question 31. Shortly after his 5-year-old daughter was hospitalized, a father tells the nurse he's concerned because his daughter has started to suck her thumb again. She had not sucked her thumb in over a year. What is the nurse's most appropriate response? A. Many children regress when they're in the hospital. Young children often deal with stress or anxiety with regressive behavior. Illness, pain, and separation from family cause distress. The child may return to a behavior that was soothing, such as thumbsucking or clinging to a favorite toy. Question 32. Before touching a crying client to offer comfort, the nurse should consider: B. The client's cultural background. Western culture uses therapeutic touch as a way to offer support or comfort, but other religions or cultures may consider it a violation of privacy. For example, Asians or Muslims do not welcome touch by strangers or by someone of the opposite gender. When in doubt, ask for permission or be conservative in your approach. Question 33. For a patient with a substance abuse problem, which of the following goals would the healthcare provider identify as realistic? B. Identify situations that trigger a desire to use the substance. Most patients with a substance abuse problem will not be able to use the substance in moderation. The most realistic goal for a patient with a substance abuse problem is to avoid people, places, and events that can trigger substance use. Continued substance abuse is associated with a lack of effective coping skills rather than a lack of willpower. Question 34. When a nurse is administering medication to an inpatient with paranoid schizophrenia, which is the best method? A. Leave the patient's door open. When working in mental health settings, the safety of the patients and staff comes first. The patient's door should remain open, except for an invasive procedure, which requires a second staff member as witness and chaperone. Medications are given by schedule, not patient behavior. A nurse should never look elsewhere or turn away from a patient, especially if the patient has a diagnosis that includes possible angry or violent behavior. Question 35. The home health nurse is developing a care plan for a 16-year-old male with Duchenne muscular dystrophy, DMD. The client has limited mobility and is unable to perform ADLs. He is at risk for depression related to which of the following? D. Lack of identity. Duchenne muscular dystrophy and NBSB winking sad smiley DMD is one of a group of genetic disorders that gradually weaken and damage the NBSB muscles. DMD is the most common muscular dystrophy in children, usually diagnosed between 3 and 6 years of age. Early signs of the illness include a delay in walking, difficulty rising from a sitting or lying position, and frequent falling, with weakness typically affecting the shoulder and pelvic muscle as one of the initial symptoms. Children and adolescents with DMD are at a higher risk for psychosocial issues. Erickson's Stage 5, ages 12 to 18, of identity versus role confusion is difficult for teens with DMD, because their limited mobility and dependence can prevent them from developing their own identity. Stage 2 is autonomy versus shame and doubt, ages 18 months, 3 years. Both control and possible shame are part of this stage. Erickson's Stage 4, ages 5 to 12, is industry versus inferiority, when a child develops a sense of competency. Question 36. When a healthcare provider is caring for a patient who is having an acute panic attack, which of the following actions by the healthcare provider is most appropriate? D. Offer the patient reassurance of safety and security. During a panic attack, the patient experiences intense apprehension and fear. There are often physical symptoms too, such as chest pain, palpitations, and trembling. During the panic attack, the patient's focus is on the distressing physical symptoms caused by the anxiety. Distraction techniques, open-ended questioning, or exploration of phobias will not be helpful during an acute attack. The patient may experience a feeling of impending doom and fear for their life. Therefore, reassurance of safety and security is the best initial intervention for this patient. Question 37. A patient presents to the clinic with a report of fatigue and difficulty concentrating. Which additional statement made by the patient would alert the healthcare provider to possible marijuana use? D. I've noticed that my eyes are red lately. Marijuana use can cause corneal vasodilation and conjunctivitis. THC, tetrahydronaban, the active ingredient in marijuana, affects thinking, memory, appetite, and coordination. It's more likely that marijuana would increase appetite, decrease anxiety, and promote sleep. Hallucinogens such as LSD, lysergic acid diethylamide, can cause nightmares and flashbacks. Question 38. A patient who overdosed on oxycodone is given naloxone. When assessing the patient, the healthcare provider should anticipate which of these clinical manifestations of opioid withdrawal. D. Irritability and nausea. Naloxone, an opioid antagonist, will displace opioids at the opioid receptor sites. The healthcare provider should expect to observe irritability and nausea. Heart rate and blood pressure will be baseline or elevated, and temperature will be unchanged. Depressed respirations and somnolence are signs of opioid intoxication. Question 39. The nurse on the inpatient mental health unit is approached by a male client who voluntarily admitted himself 3 days ago for active suicidal ideation. He tells the nurse, "I want to sign out, now." What is the nurse's best response? D. Let's talk about your decision before we prepare your discharge. The nurse should try to talk to the client to determine the reason for the decision and if the client is still actively suicidal. Active suicide ideation is when a client has thoughts of suicide or self-harm, and has developed a plan to carry it out. Clients who are voluntarily admitted may have the option of signing out against medical advice, AMA. Providing discharge instructions, including community resources, is always preferred, but may not be possible. If the nurse feels that the client is still at risk for suicide, a petition for an involuntary admission hospitalization should be initiated. The other options are not appropriate. Question 40. 2 weeks after giving birth, a new mother calls the clinic and reports pronounced fatigue, sadness, and tearfulness. She states, "I feel so overwhelmed, I don't know what to do." Which of the following questions is most appropriate for the nurse to ask? D. Do you ever think about harming yourself or your baby? Feelings of fatigue, sadness, and tearfulness can be common symptoms experienced in the postpartum period. Postpartum blues usually occur in the first few days after giving birth. Postpartum depression usually begins 1 to 3 weeks after giving birth, but it can occur up to 1 year after giving birth. Both postpartum blues and postpartum depression share similar symptoms, such as sadness, crying spells, mood swings, irritability, and insomnia. However, clients who are diagnosed with postpartum depression may experience more severe symptoms, including thoughts of harming themselves or the infant.